Rehab care has made us better, without any question.
The type of partnership that we're seeing is the ability to identify needs and go out there and address them.
A partnership in excellence.
Your workforce has become clearly a top listed issue for Nebraska's providers, and as the association, when it becomes such a pressing issue for the members, it becomes a big deal for the association. So Nebraska's minimum wage has changed, not to some of the levels you've heard in other states, but has gone up about $2 for our state over the last 2 years. And so that's caused some real pressures from reimbursement things, but also from just the sheer numbers. Nebraska's unemployment is under 3%, so the availability of people is really tight. And we've tried some interesting things at the association level. So as an example, we developed a new workforce task force, and so the idea of that is to find maybe some short-term solutions and then trying to work the long game on workforce and see if there's some things we can affect over time. We've engaged and tried to work in a bigger and better way with our decision makers. So our governor and the Department of Education in Nebraska, the Department of Labor, trying to find ways to engage things over time. The unfortunate side of workforce, and this is probably no different for any state, but the unfortunate side is that it is not a short game. There are some things we can do in the interim, but it's going to take some time to move this. And then as you look forward, the pressures that we feel today are one thing, but the need for workforce over time is going to grow exponentially. And so it really does make a big difference from a strategy perspective to be able to work on this now. So we've engaged, as I said, we engaged the Department of Labor and the Department of Economic Development, trying to do things across our state. We're a rural state by nature, and so working with DOE and DOL to engage communities and the providers in the communities in a different way, trying to get to young people to create career tracks, especially in the rural areas, at a younger level. They're talking 7th and 8th grade things. There's some dollars available in Nebraska to create some of those paths. And I think those, getting younger people interested in the health path, whether it's just post-acute care, will be interesting, but trying to get them engaged in those and trying to get them interested in those kind of things going forward. At the association level in Nebraska, we're very engaged in the caregiver level. So we have nurse aid training and medication aid training that we do all across the state. We're actually accredited with the Department of Education as a post-secondary accredited career college. So it's an interesting way in Nebraska to do that. One thing I know for sure, this is a massive pressure that the members are facing, and when you look at all the other things with reimbursement and those other issues in front of them, this one is getting larger. And I think that if we can help the members, again, in the long run, if we can help them engage workforce in a different way, maybe make it more interesting for some of the Nebraska workers that are there, maybe we can help them in some time.